Hello, my name is Bianca Brown, and I'll be partnering with Jeanny and Widjaja to present our project, Table of Evidence and Evidence-Based Practice Project. So before we get started and discuss the PICO question, it is important to identify what is diabetes. Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. Most major risk factors of diabetes include being overweight or obese, age 45 and older, family history of diabetes, lack of exercise, and of course, high blood pressure. So what is the significance of diabetes? Diabetes mellitus is the third leading cause of death, and when not controlled, complications of diabetes may lead to neuropathy, blindness, renal failure, and heart attacks. Exercise have shown to contribute significant benefits and highly recommended for people with type 2 diabetes. There have been specific guidelines that are recommended for type 2 diabetics, which consists of exercising several times per week for a specific time frame in order to prevent life-threatening complications from diabetes. However, people with type 2 diabetics are found to have low compliance rate to the recommended exercise training, and based on that compliance issue, we came up with our PICO question. In type 2 diabetic individuals, middle age and greater, does participation in aerobic and/or resistant training exercises for 8 to 12 weeks with a frequency of 2 to 5 times weekly improve A1C levels? So what is PICO? PICO is a specialized framework to form a clinical question and facilitates evidence-based research. So in our particular question, P stands for population, which is the type 2 diabetics middle age and greater. I stands for the intervention, which is the participation in aerobic and/or resistant training exercises for 8 to 12 weeks with a frequency of 2 to 5 times weekly. C is for the comparison, which is no aerobic and/or resistant training exercises. And O is for outcome, which is the improved A1C levels.
For the PICO questions that we have, we conducted a review of literature searching method through the peer-reviewed articles. We searched the articles that were published between 2014 to 2019. As a comparison, we only used 2 articles, which are from Dixit et al. Article and Akinci et al. Article. Dixit et al. Article was a quantitative research study. They were using randomized controlled trial with comparative and controlled experiments. Meanwhile, Akinci et al. Article were a single-blinded study that also using randomized controlled study. Both of research studies have their own objectives. There were varieties in type of exercise that had been used to measure the outcome. The objective of Dixit et al. Article was to evaluate the effect of 8 weeks moderate intensity aerobic exercise on the glycemic control in elderly patients that has type 2 diabetes and diabetic peripheral neuropathy. Meanwhile, the objective of Akinci et al. Articles was to evaluate the effect of internet-based and supervised aerobic and resistance exercise for 3 days per week for 8 weeks on the glycemic control of type 2 diabetes. From both of studies, we have hypotheses for its research study. For Dixit et al. Article, the hypothesis is practicing moderate intensity aerobic exercise for 8 weeks leads to improvement in glycemic control in elderly patients that has type 2 diabetes and diabetic peripheral neuropathy. The hypothesis for Akinci et al. Article is combining aerobic exercise and resistant exercise for 3 days per week for 8 weeks will improve hemoglobin concentrations in adults that has type 2 diabetes. There are some key variables that had been used for these research studies. The key variables that had been used are independence and dependence variables. For Dixit et al. Articles, the independent variable is moderate intensity aerobic exercise for 8 weeks. For dependence variable are glycemic control, postprandial blood sugar, and fasting blood sugar. For Akinci et al. Articles, the independent variables are internet base of aerobic and resistance exercise and supervised group base of aerobic and resistance exercise. The interventions are for 3 days exercise per week for 8 weeks. For dependent variables for Akinci et al. Articles are glycemic control and blood lipids. Both studies, using the same control groups, which are diabetic patients who participate in no physical activities. Both articles supported our PICO questions. The synthesis of result studies indicated that exercise results significant benefit on the glycemic control. Hemoglobin levels was used as a comparison tool between the study groups and the control groups. Dixit et al. Articles indicated that there was a significant difference in the mean value of the hemoglobin level at baseline on the 8 weeks compared to the controlled group who did not participate in any physical activity. Akinci et al. Articles found 0.8 hemoglobin levels that decrease in the supervised exercise group and 0.9% in internet-based exercise group. Dixit et al. Articles specified their limitations elsewhere outside the report. And then Akinci et al. Articles claimed the limitations for their research studies was because the sample size was too small and the percentage of subjects that leaving the internet-based exercise training group was high. It was a total of 52.3%. The subject of internet-based exercise training group excluded from the study. The reasons because the insufficient adherence to the program.
Implications into nursing practice. So the results from our research can be presented to the clinical staff and serve as a reinforcement of how valuable it is to educate our diabetic patients. Their participation in aerobic and/or resistant training exercises will not only reduce their A1C, but prevent worsening complications from diabetes.
The results that we learned from both research studies were the proof of our initial hypothesis. We conclude that both articles, the Dixit et al. Articles and the Akinci et al. Article, demonstrated evidence and support that participations in aerobic and or resistance training exercise improve hemoglobin levels in type 2 diabetes individual. Thank you for listening our presentations.